My name is David Mercer. I was born in Canada, and I grew up most of my life in Western Canada, in Edmonton, Alberta. And it was in Edmonton that I did medical school, and I did my surgical residency at the University of Alberta, and I did a PhD at the University of Alberta. And then I came to the University of Nebraska Medical Center to train in transplantation from 2002 to 2004. Once I finished that up, I returned back to Canada for a couple of years and then got recruited to come back to Nebraska. I'm a liver and intestine transplant surgeon, and so I do a lot of surgery associated with transplantation patients. But in addition to that, I'm also the director of the intestinal rehabilitation program. And so I work with patients, adults and children, who have lost the majority of their intestine, and we work to perform, in some cases, a series of complex operations in association with medical care and dietary care. I think as I was going through my training in different facets of surgery, I had the opportunity to observe lots of different ways that physicians interacted with their patients and that surgeons interacted with their patients. And I think that it was the closeness of the bond between the surgeon and the patient and the technical elements of the surgery that brought me to want to be a transplant surgeon. Academic medicine for me has always been the course that I've wanted to pursue, because I think that I've always wanted to be associated with people who are the leaders of our profession, and that comes from being in an academic environment. This is the kind of place where we have the ability to push the limits on what people are doing, push the limits on how we can treat patients, get the most new therapies, be the most aggressive with treating the most complicated problems. And for me, that's the type of surgery and the type of medicine that I want to practice. It was when I was in second grade and a doctor came to visit our classroom, and I thought to myself, once they explained what they did and how they helped people, I thought that's what I want to do. Becoming a surgeon is a different process. That comes much later on in your training, when you start to find out the things that you truly love and that you gravitate towards. But in my life, there's just never been anything that I've wanted to be other than a doctor.